Hello, everyone. Welcome to today's episode. We are focusing on something that touches families, friends, and neighbors across our community: breast cancer awareness. Our goal today is simple: to educate, empower, and remind you that early detection truly saves lives. We are joined by our very special guest who is dedicated advocate and expert in breast health, Dr. Vishal Ranpura. Please introduce yourself and tell us a little bit about you.
Yeah, so I'm a board certified hematologist oncologist, and I practice in Gwinnett County. We have about 5 offices in that location. And I've been a hematologist and oncologist for last 10 plus years. And I used to practice in California, and I see all types of cancer, patients in my practice.
Okay. So now let's understand a little bit about breast cancer. To start it off, I would love for you to help us listeners understand the basics. How would you explain what breast cancer is in simple terms?
Yeah. So, breast cancer, or for that matter, any type of cancer that develops in the body, the cells are dividing uncontrollably. Usually our cells, they grow, they divide, and they die in a very predictable fashion. There's a system behind that in terms of how it happens. But when certain things happen in the body which predispose them to develop cancer, and the cells start dividing rapidly and uncontrollably, and then that's how they form a lump or a mass that you find or people find in their breast, or you see that abnormality on mammograms and ultrasound when they're doing the screening test.
So, breast cancer isn't just one disease, there are different types. Can you walk us through the main ones and why those differences matter?
Correct. Yeah. So, just by looking at where the cancer is originating in the breast, there are two different types, and there are other types, but the two most common ones are the ductal carcinoma and the lobular carcinoma. The lobular carcinoma happens in the milk-producing glands, whereas the ductal carcinoma happens in the ducts, which carries the milk from the lobules to the nipple. So these are the two main, histological types we see. Apart from that, the way we classify breast cancer into other types is based on the receptors. So if they're dependent on the female hormones like estrogen and progesterone, they're called hormone positive breast cancers. We also test them for another protein called HER2 protein. If they're positive for that, they're called HER2 positive breast cancers. If they're positive for all three, they're called triple positive breast cancers. If they test negative for all three of them, they're called triple negative breast cancers. And then they all behave a little bit differently, some cancers being more aggressive and some cancers being less aggressive. And the treatment is very dependent on these markers also. So it is very, very important to know what type of cancer you have so that we can come up with a better treatment plan.
Now, let's talk about support and survivorship. What does meaningful support look like for someone going through treatment?
Yeah. So, support can be, mean anything, from simple things like just checking in by a phone, asking them how they're feeling, if they need anything else as like an emotional support, to helping them, like, taking them, like, for treatments, accompanying them for, any other nutritional appointments along those lines, giving them rides, helping them with childcare. Sometimes they might need a little economic help. So there are different ways how we can support, these patients.
Okay. And caregivers often carry a heavy emotional load. What resources or advice do you have for the team?
Yeah, so usually there are like caregiver support groups that a lot of the cancer centers may have, that they can talk to each other, and there are a lot of online support groups that are there, not only for patients but even caregiver support groups too. So they can talk to them and get an idea about how other people feel and their journey too, so they can better understand and navigate it.
Okay. And for anyone listening who is getting scared, what would you say to them?
Yeah, so I would say that knowing is always better than not knowing. A lot of the times, as in this condition especially, ignorance is not bliss, right? So you want to know what's going on, and getting known means if you feel something, you want to get it checked out, and if you don't feel anything, at least you want to get your screening test done. As I said earlier, that mammograms can be uncomfortable, but they do truly save lives. So you want to get screening on a regular basis.
Okay. And as we wrap up, what is one message you want to give to all listeners to take away from today's conversation?
Yeah. So the main important thing I want people to understand is that early detection saves lives, because if you are diagnosed early, there is a higher chance of you getting cured versus if you get diagnosed late. So that's why early screening exam, like screening on a regular basis. If you feel something that is not right, you want to get it checked out. So those are all very very important. Okay, and those things will help you to get diagnosed early in case if you have a breast cancer. If you have early diagnosis, treatment is simpler, higher chances of cure.
Okay. Well, thank you so much for sharing your knowledge and your heart with us today.